my name is Cecile Chang, and thanks for joining us for this month's Conversations with Dr. Jeff Levin-Scherz, where we ask Dr. Jeff about COVID-19 and what employers can do to respond to the evolving landscape. Hey, Jeff, how's it going?
Hi, Cecile. So nice to see you.
All right, so we're in mid-March. Can you give us a bit of a view on what's going on in the country? And I actually read an article this morning about wastewater, monitoring wastewater to evaluate COVID-19 in communities. And if you can say a little bit about that, that would be great.
Sure. I mean, all in, the news has been good over recent weeks. So our case rate is down by really 2/3 over a month. Hospitalizations are down. Deaths are finally down, down to around 1,300. Down by about 1/3 over the last 2 weeks. Obviously still a tragic loss of life, but nothing nearly as bad as things were a month ago. So I think that what we've seen is the Omicron wave, the worst of the Omicron wave, at least this one, has passed, and that's good. And that's pretty much true across the country. Now, when we look elsewhere in the world, there are some worrisome signs. So most European countries are seeing an uptick in cases as well as an uptick in hospitalizations. We've often followed Europe in terms of COVID, and there's no reason to believe it will be otherwise. If I look at wastewater signals of viral infection where I live in eastern Massachusetts, the numbers are actually very close to zero. They're really good. The CDC has finally started to report from over 400 different sites across the country. And, what they're finding is it varies. And there are a bunch of places that are showing an increase in viral copies per milliliter in the wastewater. So I think we have to watch this carefully. It does feel likely that there will be some, new outbreaks, and I think that's something that employers need to keep a close watch on.
That's actually a good segue to my follow-up question, which is as the infection rates decrease, what should employers be focusing on?
Well, for one thing, I do know that there are a lot of employers that feel like they've been distracted for the last 2 years, and now they can simply go back to their core business and just forget about the pandemic altogether. And I think that the wise business approach in terms of thinking about mitigating risk is to recognize there's a chance that there will be another wave or outbreaks in some of the communities that they have employees in. And even if there's not, that some degree of preparedness makes sense because we are likely during our professional lifetimes to face other pandemics too. And so what I hope employers will be thinking about is, continuing the efforts to get people vaccinated and boosted. That's the best way to prevent, illness, business disruption, and death. Thinking about ventilation, which can decrease influenza as well. I think that employers should be thinking about what are the set points where they would institute masks, or where the set points where they might go back to remote work, and think about those in advance so that when there is an outbreak, they'll already know what they want to do and it won't disrupt their business as much. Employers also should be thinking about mental health of their employees. And I think that there's a lot more anxiety and depression, an enormous amount more need now. And I think that needs to be on employers' minds.
So one related element to employer responsibilities is coming up around treatment for long COVID, which looks like it is much more prevalent than we might have initially expected. What are your thoughts around long COVID overall, as well as employers and what they should be thinking about?
Yeah, so there's some good data from the United Kingdom that suggests that about 1 in 6 people who've recovered from COVID have some symptoms as long as 6 months later. The good news is the number of people with symptoms seems to go down progressively over time. So sometimes some of those people might not have lifelong long COVID, but might recover. That's certainly the hope. I think there's also much more information about the biological basis of long COVID. And so, we're starting to see abnormal nerve biopsies, evidence of micro blood clots, evidence in some instances that people continue to have viable virus in their bodies, which might be causing some symptoms. All of that might eventually lead to a good treatment for long COVID, and that would certainly be welcome. I think employers need to recognize that we might have more workforce shortages because of long COVID. Need to think about how to provide better accommodations for people who might not be able to work at exactly what they were doing before full time if they continue to have symptoms. And I think that working on being sure that managers understand that long COVID is real and don't stigmatize the people who report symptoms of it, I think will also be important.
Thanks. Thank you for that guidance. What are your thoughts about the latest evidence for COVID vaccines for kids?
Yeah, there's been a lot of noise around this issue. It turns out kids don't get hospitalized that often for COVID. They've been hospitalized a lot more and unfortunately died a lot more from Omicron than previous waves. But as a result, it's somewhat hard to reach statistical significance for preventing hospitalizations in kids just because there aren't that many of them. So for instance, the study that's often cited that didn't show statistical significance for preventing hospitalizations in kids 5 to 11 actually lowered hospitalizations by 50% and lowered ICU stays by 75%. There are not many parents who, if they knew that data, would say, well, I'm not going to give this incredibly safe vaccine to my kid because this hasn't reached statistical significance yet. So I would encourage people to look at the data, talk to their pediatricians, and get their kids vaccinated. And hopefully we'll have some new news later this month about vaccine results in kids under 5, because I know that there are many parents who have their kids in daycare and who deeply long for COVID vaccine for their younger children.
Right. So just thinking about my own behavior around preventive care, I have been dragging my feet despite the fact that I no longer have a commute and re-engaging with my preventive care routines. What are you seeing with respect to other people? Maybe it's just me, but what are your thoughts about return to preventive care and what employers can do to nudge that along?
Yeah. So, screening for breast cancer, colon cancer, and cervical cancer dropped precipitously in the spring of 2020. It never fully recovered. So we didn't see a bump of people coming back and getting those screening exams. And it continues to be lower now than it was in 2019. And, the result in the end will be that we will diagnose some cancers later than we otherwise would. And people might have cancer that's incurable or might have cancer that requires much more radical treatment. And on the cancer screening side, yeah, people should go back to evidence-based preventive care. I'm especially worried also about childhood vaccination rates. And overall, in spring of 2020, childhood vaccination rates were down over 40%. Again, similarly, they've never fully recovered. Kids under 12 vaccination rates are similar to where they were in 2019 now, but with no big bump to make up. For adolescents, vaccines continue to be lower than they were back before the pandemic. So I think that this puts us at much higher risk of having measles epidemics. Childhood vaccines are one of the few things in the medical system where every dollar spent on vaccines actually saves $10 in medical costs. So, what should employers do? Encourage employees to go back to preventive care, and that includes vaccines for kids.
Okay, thanks. That's good advice. What can employers do to help protect immunocompromised employees?
Yeah, I think it's really important. About 3% of the U.S. adult population is on a medicine that causes immunocompromise. There are other people who might have other diseases that compromise their immune systems too. So the first thing employers can do is encourage as many employees as possible to get vaccinated. That surrounding somebody who is at risk and who doesn't have good antibodies with other people who themselves have the least risk of carrying COVID is really important. ventilation actually protects everybody, but especially important for people who are immunocompromised. There is a monoclonal antibody, Evusheld. It's an injection. It's good for 6 months of protection. So for people who get vaccines and they don't really seem to do much, there is a drug out there. It's been in short supply, but it is available. And some research shows that most of what the government has purchased is still sitting on shelves. So that's important. Knowing that there will be better access to oral drugs for people who catch COVID despite vaccines, whether they're immunocompromised or not, is helpful. And I think that employers should create an environment where people who want to wear masks for whatever reason, including that they might be immunocompromised, feel totally comfortable wearing a mask. And if an employer is in communities where there are outbreaks, they might actually go back to requiring masks, or even go back to remote work. For people who with immunocompromised, or remote work for everybody who can, depending upon how severe the community outbreak is.
Got it. So here's the $64,000 question, or maybe it's a $64 million question. What impact do you think the pandemic, past 2 years, is going to have on healthcare costs in upcoming years? So for 2023 and beyond.
Yeah, Cecile, I'm glad you brought this up, because I think this is an underappreciated problem. So for starters, the government has been paying for a lot of medical care over the last 2 years, and it's going to stop. Biden, in his American Pandemic Protection Plan, had $36 billion for buying vaccines and buying treatments, and that hasn't passed Congress and doesn't have a very good chance of passing Congress. So all of those dollars are going to actually, all of those dollars are going to go to payers, many of which are employers paying for their employees. We'll have higher unit prices because of provider consolidation. Providers will also have a lot more public sympathy, so that'll give them more leverage at the negotiating table. And so, we should expect rates to keep on being higher. Providers are also facing higher costs for inflation in general, medical supplies, especially for labor. We're hopeful that virtual care maybe will lower the cost of care a little bit, but frankly, access to virtual care could increase utilization, could actually increase care. We talked about long COVID. If we're successful and we have a treatment for long COVID, it'll probably be expensive. And, we're seeing evidence that strokes, heart attacks, and congestive heart failure are much more common in people who just recovered from COVID. And so I think that we'll continue to be seeing increased costs for that. So I think we're leaving the time of relatively low medical inflation, unfortunately.
All right. Well, it's better to be prepared and aware than to be caught off guard. So we'll take that into consideration. Any parting thoughts for us this month, Jeff?
I try to come up with a quote from something that something that I thought was impactful. And this is from Catherine Wu. She's a staff writer at the Atlantic magazine. It was earlier in March, and what she said is, we can't say when the next threat will appear or how formidable it will be, but we do have some control over its emergence. The more chances we give the virus to infect us, the more chances we give it to change itself again. So the interpretation is, if you want fewer variants, let's get everybody vaccinated. And that's a U.S. thing, but let's also be sure that we help get the entire world vaccinated, because, the coronavirus really doesn't respect any kind of international boundaries. Right.
All right. Well, thank you for that parting thought. And thank you all for joining us for this month's Conversations with Dr. Jeff Levin-Scherz. We will see you next time.